And now I'll turn us over to Dr. Fawcett. Hi, David.
Hey, Scott, thank you so much for that introduction. I've become more proficient in learning to work with Zoom's blur effect too, is getting that picture, that title more in focus. Anyway, good to be here. Hello, everybody. Welcome. As Scott indicated, I usually start with a little bit of talk about some topic. And the topic I wanted to speak about tonight is something that we see a lot. And that's sensation seeking or chasing intensity, basically. And we call sex and porn addiction and chemsex addiction, usually amphetamines, as intensity addictions. And they have a lot in common with the fight or flight chemical response in our bodies. When we get traumatized or in danger, our bodies pump adrenaline and dopamine and fuel blood to our legs, and our pupils get big so we can see it, so we can fight or flight. And basically, these addictions do the same thing chemically. And it becomes very hard on our bodies. It becomes very hard on our minds. And there's a price we pay. But I want to just dive into that sensation-seeking aspect of sex addiction a little bit and see what's going on. I think, one of the things we know is that drugs, there are different drugs, of course, that merge with sex, and they do different things. And a good bit of them, like amphetamines, also raise that intensity level, the sensation level, so it becomes exciting. And so drugs, gambling, porn, sex, shoplifting, work, exercise, high risk sports, all those things get that same chemistry going in our bodies. And that can be kind of addictive. And many people, in fact, become addicted to that intensity and find other ways of creating that chemical response in their bodies, whether it's sex or porn or gambling, and they may move around different ways of dealing with the intensity. By the way, just as a footnote, other drugs like alcohol or opioids or benzodiazepines are not about intensity so much as they are about numbing or just kind of going, disconnecting from those emotions. So the roles of thrills and intensity has a big part of sex addiction and chemsex addiction. And if we do some of the deeper dive into the research on that, we find, and we've talked about this a lot, there's a strong association between a history of traumatic experiences and intensity addictions like sex and porn and chemsex. And so this was a mystery in the literature for a while, because the assumption was if you've been traumatized early on, you want to avoid, you become very avoidant about anxiety or stimulation because it triggers fear. But there's a certain group of people, these intensity seekers, that despite that trauma, or in fact, maybe because of it, really start to seek out the sensation as a way of distracting themselves, as a way of feeling alive, as a way of feeling that they're engaged somehow and alive. And I think that is what we start to see with addiction. There's been so many interesting studies on trauma, levels of trauma. We know that people who are trauma and who use amphetamines, who have trauma, are much more likely to develop PTSD, for example. People that are meth users who've had trauma are almost always also have PTSD, as opposed to other people who may just have trauma without the development of PTSD. So there's a lot of interesting work going on, correlations going on with its sensation seeking and its role with trauma. What happens when we introduce a bunch of stimulants or these behaviors like sex or porn addiction, which create this chemical thing in the brain? There's a lot of things that happen. One is that there's a lot of chaos that sets in. So it's really hard to focus. It's really hard to bring a project to fruition from one step to the next. People get distracted. People start 1,000 projects. It's very much ironically like having ADHD. It kind of fuels that paradoxical response. The other thing we see, though, emotionally, is that people start to disconnect more and more with their feelings. And we've had some really interesting opportunities to watch clients when they come to Seeking Integrity in LA. I remember once recently, a guy came in on prescription amphetamines. I think it was Adderall, although it could be Ritalin or Vyvanse or any number of them. But he had to withdraw from those amphetamines while he was with us. And for the first week, early in that withdrawal, he was unable to get in touch with any feelings at all, as much as he tried. And he was a very educated person who was proficient in the vocabulary, the emotional vocabulary, but he couldn't feel it. And then over time, we could see his feelings starting to wake up over the course of a couple of weeks as the amphetamines detoxed from his body. And so it was really a dramatic example of how these drugs just impact the ability to access feelings, to have empathy, to have compassion. And I think that's a big part of the danger and damage we see that's caused by sex addiction, that ability to really have compassion. We also know that the chase for intensity itself can become addictive, right? People get addicted to that, the thrill, the heartbeat, the sensation of it all. And that itself can become sort of a self-fulfilling prophecy in that. Finally, because of dopamine with intensity, it's unsustainable. So we can't keep up this dopamine chase. And eventually the same activities will net less dopamine and less intensity. And so people have to account for that tolerance by escalating their behavior. And so we can move into more taboo behaviors or rougher taboo or kinkier behaviors or more drugs or go from smoking to ingesting, or anything we can do to kind of increase the intensity of that. So that's the sort of dangerous package of sensation seeking and intensity and sex and chemsex addiction. So that's what people face when they sort of come into recovery, this addiction to this kind of intensity that just causes a lot of chaos in life. So what can we do? One thing is just really starting to develop a habit of mindfulness. And by mindfulness, I simply mean being really aware and in touch. And that's hard. As I mentioned, the client we had who, as he detoxed from amphetamines, was able to get more and more, have more and more access to his feelings. And so to really start to learn that, to really learn physical cues. And this is something that's really important. When we ask our clients to identify a feeling, I almost always ask, well, where do you feel that in your body? Because I'm trying to help them map out not just what the emotion feels like, but where are they physically sensing that? And this is important for sensation seekers because that trauma also gets recorded in our bodies, right? So when we have a traumatic experience, there may be panic, we may have a lump in our throat or a twisting in our stomach or a tightness in our chest. And those symptoms, as they get triggered 30 years after trauma, remind us of that trauma and can trigger actually a traumatic response. But they can also be ways of triggering using to act out. So if I have a tightness in my chest, I might interpret that as anxiety and try to deal with that by getting to some intensity activity to sort of numb it or distract myself from it. So identifying those physical symptoms as a way of lessening the triggering response to drop into trauma is also really important. So long story short, just becoming really aware of one's body and one's feelings. Grounding techniques, we go over those quite frequently. So the 5 sense grounding where, 5 things I can see, 4 things I can smell, 3 things I can taste, that 5, 4, 3, 2, 1 thing. The different kinds of breathing, 4, 7, 8 breathing, where I inhale for 4, hold for 7, exhale for 8. Different grounding visualizations, speaking. Sometimes people picture grounding cords or cables going down from their body into the earth to kind of keep them firmly rooted. So just really to bring yourself back to earth when you start to sort of spin up in that sensation-seeking world. Skills for emotional regulation. This is something that addicts are terrible at the beginning because we've been using our addictions to regulate our emotions. That's how we controlled things or tried to control them. So what does this include? And these are some of the DBT skills, I would say, the dialectical behavioral therapy skills like mindfulness, like techniques to regulate your emotions, to make decisions, to build compassion and empathy. These are all practical skill sets that are inherent in DBT. So I think DBT, dialectical behavioral therapy, is a really wonderful adjunct to this kind of early work in recovery to help us get grounded. Corrective self-talk, we are our own worst enemy. I remember my sponsor telling me the neighborhood between my 2 ears was a very dangerous neighborhood that I should never go into by myself because it's up here. And so we really need to correct the self-talk, the negative self-talk, the negative beliefs we have about ourselves. But we have to do this not only with ourselves, but with other people. We need to express what's going on. We need to ask for help. We need to have that life-saving connection that we talk about when we have a supportive, kind of a robust support system. And then finally, I think through this process of learning to feel feelings again in a healthy way, to process them, to stay connected, to not spin out of our bodies every time we get bored or triggered or uncomfortable, but to stay present what do we need? We need self-compassion. I think all of this starts with being gentle with ourselves. And I find that especially intensity addicts tend to be pretty harsh and fast and impatient. And I think learning patience, learning compassion is really a critical skill to just slowing it all down and really starting to make changes that last. I think I'll stop there. Thanks, Scott.
Thank you, David. I have some questions, but they're about me, so I'm gonna save those for later.
It is all about you, Scott, so it's okay.
If it's all about me, yeah. So we have a question left from last week, and I had promised that we would do it first this week. So the question is, what do I do if my porn addicted husband is not open to getting help? He does seem to be getting better, but I don't know how to trust it when it's never fully been confronted or treated.
Boy, yeah, I think every addict has this fantasy that we can do it ourselves, right? We don't really have to go to all this trouble. Oftentimes that gets put into like, well, if I had enough information, if I read enough books or watch enough webinars or whatever, that I'll get the information I need to get this right. And certainly information is part of it, but it's not the whole story. And the healing process, it's absolutely essential, in my opinion, is to really engage in a recovery process. It requires commitment, it requires surrender and acceptance of the fact that there's a problem, a willingness to make changes. And we have this beautiful 12-step solution for some of that that guides people through this recovery process. But I think if you can't get treatment, if you can't get therapy, if you won't go to a meeting, these are all the steps that I think are absolutely essential. So I don't know, in a situation like that, sometimes we can urge people along. Sometimes people do consults with us or something, and we can kind of talk and help break through that denial. But we know, unfortunately, that denial is a really key symptom of any addictive disorder. And if somebody is in that space where they're just telling themselves, oh, it's not so bad, or I can do this myself, or this is a phase, or I don't know, whatever people are telling themselves, it just is delusion. Yeah. And that's a harsh word, but I'm afraid that's what it is. I think we really need to be able to surrender and find our way.
Yeah, it reminds me of, I'm also in AA, and there's a term called dry drunk, and it's people who don't drink, they've stopped drinking, they're white knuckling it, and they've stayed sober often for many, many years. But they're not much fun to be around because they haven't made any changes, they haven't addressed the underlying issues, all of that stuff. I have two good friends, they're brothers. Well, one of them's a good friend, one of them's not. They're brothers. Without knowing it, they both quit drinking on the exact same day. One of them went to AA and has been in AA ever since. The other one went to like 2 meetings and decided, no, not for me. But he stayed sober or dry. He hasn't had a drink since then. And we're talking about 40 plus years with both of them. They're both very smart. They're both successful. One of them is loads of fun to be around, and the other one is not. You can figure out which is.
Guess which one?
Yeah, I mean, the one who goes to meetings and works a program is loads of fun. The other one is just hard to stomach for more than about 1 second at a time. He's just really unpleasant. Still carrying around resentments from 60 years ago. It's really, I haven't worked through this yet. So yeah. But it is possible to stop addictive behaviors and kind of white knuckle it, but it's not fun and I don't recommend it. So yeah, if you're an addict and trying to do that, no, go to meetings, do yourself a favor and the people around you a favor, go to meetings. Okay, next question here. I have the Covenant Eyes app on my husband's devices, but that doesn't seem to be giving a really detailed report. It doesn't tell me which sites have been visited or let me know if there's any deleted history. Am I just using it wrong? Is there an accountability app that has the above features? I just feel like there's a lot of activity that I'm not aware of or being told about. Covenant Eyes and all of these programs have different settings, and you can ask for more or less information. Normally, betrayed partners want to know if the addict went on or tried to go on sites that are forbidden. So that's pretty much the extent of the report. Sometimes they want to know how much time is spent online, things like that. If you want to know every little thing that your husband did, I think you can set it up that way, but I don't recommend it. You know, do you need to know that your husband was, you know, shopping for books on Amazon? I don't know, maybe you do, but you know, yeah. But you can have more or less info given to you, but you can get too much. David, I think you wanted to jump in there. Go ahead.
Yeah, I just want to point out too that I agree with everything Scott just said about how the various settings in these, but I also just personally don't recommend that the betrayed partner or wife or spouse be the one that receives the reports. Because what can happen in that situation is that it puts the partner in the role of policeman, monitor, you know, accountability partner, and that's not the role of the spouse, right? And I think it's an unfair burden. It kind of puts the bad guy, monitor, police like person,
parent-child dynamic where I'm going to control your behavior and micromanage it. It's not healthy for either of you.
Yeah, it's just not healthy. I totally agree. So I would look at that. I do understand. I do the need for information and kind of wanting to know what's going on, just to kind of keep that emotional safety. But there's a lot of downsides to the spouse being the recipient of that report.
Yeah, and I agree. I never recommend that the spouse be the accountability partner, but it happens a lot. So you know, if it works for you, I'm not going to tell you not to, but normally I would recommend a sponsor or a therapist or somebody should be the one getting those reports. Next question. My particular sex addiction issue revolves around erotic hypnosis. I literally have a sex worker hypnotize and program me according to my custom scripts. While I manage to avoid fantasizing about that, I still occasionally drift off into mental fantasies, which are still fairly submissive and tend toward being controlled. I've been told that this could be related to chemsex. I'm in the SAA and have a sponsor. What else can I do to avoid these unwanted, unbidden fantasies? Is erotic hypnosis a thing, David? And is it linked to chemsex? And then let's go to the actual question, which is how to avoid unbidden fantasies.
Right. So yeah, erotic hypnosis is definitely a thing. And on both people that hypnotize and people and subjects for hypnosis. And so people use it as a way of going through inhibitions and broadening their fantasy life and kind of getting into that. So I think, yeah, it's definitely a thing. I don't know of any association with that in chemsex. It could be, but those two, I know a lot of people who use erotic hypnosis who are not in any way involved with drugs. So I think it's a different animal, but there could be overlap, of course. And it is the thing. I think the problem I have with that, and for anybody in recovery, is that we talk an awful lot about being aware of if you're in fantasy, if you're dissociated, if you're disconnected. And by definition, and I'm a hypnotherapist certified, in fact, I'm an advanced certified hypnotherapist. So I do a lot of hypnotherapy. And by definition, if somebody's under hypnosis, they are dissociated, they're disconnected, they're out of touch with their reality to an extent. Now, hypnotherapy is a very light trance, so you're not out of it, right? You're aware of what's going on. You have like 1 foot in the room and 1 foot in the past. So we can work with, that's how it works. But it is nonetheless, it's something done with a lot of training, a lot by a professional. And you know, you got a lot of amateurs that do this as well, which I worry about. But in general, I think erotic hypnosis is probably not a great pastime for anybody in recovery, simply because it's you're purposefully kind of checking out. But I think the goal toward a lot of people in recovery is to stay as conscious and present as possible, right, in the moment, in their bodies, in the mood. So I think that by itself is, and if you, depending on what you're using it for, if you're using it to get around inhibitions or whatever, I'd work on those issues in the context of your recovery or in therapy or whatever. Now, in terms of unwanted fantasies, these things, do happen. We just talked to our clients today about arousal templates and how, given our addictive patterns, we kind of set very firmly embedded fantasies into our head that just don't disappear when we decide to get into recovery. There are a lot of addictive related fantasies, some of which can get quite extreme because of tolerance and escalation. Our fantasies tend to get a little kinkier or rougher or more taboo or whatever. And so we get into recovery and suddenly our mind is full of these images that we may not necessarily want in our mind, but we can't necessarily get rid of them either. So we have to learn kind of how to live with them at first, but then kind of let them get dusty and grown over and start to find other things that give us erotic appeal. So that's the big challenge in recovery, is kind of reigniting kind of a healthier arousal pattern that takes work and patience and time. But I think when they pop in, what I would suggest is just not give it any oxygen. In a way, it's just like a dream. We can't be responsible for our dreams. By definition, those bubble up when we're not conscious. What we can do is, if our dream wakes us up, we don't have to indulge it. If it was an erotic dream, we don't have to go in over it and hang out in the space. We can just let it go. And I think the same thing happens if we had a fantasy, even for a flash in our head, and it's going to happen. What you want to do is not hang on to it. There's just like we do with triggers and cues. They talk about a wave where it peaks, it builds, peaks, and it feels almost intolerable. I've got to give in. I've got to look at this. I've got to grab onto this, and then it passes. So I think just learning to like not grab onto those when they come up, and it does help, by the way, to take an action that pulls you in a different direction. And those actions usually are making a call, doing something, right? I think oftentimes in those circumstances, the first response is like, gee, why is this going on? What's happening? But that why question is number two, right? Number one has to be, what am I going to do about this right now, in terms of taking an action to get out of danger, to change the mindset, whatever. And Scott, I'd be welcome anything you have to say on that too. Or you're muted.
Still muted. Look, I've been sober from this addiction for 20 years. I still have unwanted fantasies that show up. It's part of life. And, I've learned to just say, get out of my head. I don't need you right now. Earlier in my recovery, I had to actively practice the 3-second rule, which was give myself 3 seconds to get rid of the thought and think about something else. Either I'm humanizing the person or people I'm fantasizing about, or I just think about, what I need to get at the grocery store, or, the score of last night's game or whatever. And often I would banish the thought. 30 seconds later, it's back. So I have to do the 3-second rule again. And that's where what the last bit of what David just said comes in. I mean, if I tell you don't think about pink elephants and don't give you something else to think about, guess what you're going to do? You're going to think about pink elephants. You can't help it. So this is why we have in circle plans, and I believe this individual does have a circle plan. This is why we have the outer circle, or the green light circle. We have a list of things we can do when we are triggered or locked into a fantasy. We need to do something else. We have to replace it with something else that's healthy, whether that's walking the dog or playing with the kids, or making dinner for your wife, or calling your sponsor. Just do something else is the big piece of advice, particularly early in recovery, because I can't just not think about something. I have to do something else.
Those grounding techniques I referred to earlier too, by the way, are really useful. Part of them, they work, but part of the way they work is they distract us. If I'm thinking about 5 things I can see and 4 things I can taste and 3 things I can smell, my mind, we can't really truly multitask, because people say we focus on one thing at a time, and that forces us to focus on something else besides that fantasy we just had. Same thing with the 4-7-8 breathing. If I'm counting my breaths, I'm not thinking about that fantasy. And so those kind of grounding techniques really do help pull us out of that dangerous space.
Yeah. Oops, sorry, didn't mean to send that so soon. I hope it's okay that we just answered the previous question. This is like, oops, sorry, didn't mean to send that so soon. But it was a great question. So, okay, next one. Is it safe to assume that someone in addiction, so addicts, are control freaks? With teaching through therapy to let go of control, aid in the process of committing to 12-step recovery. Interesting question. Are addicts control freaks, and what can we do about it?
Yeah, that's a really great question, actually. I think a good number of addicts, I would say, are control freaks. And I think there are some who just really use their addiction to kind of do the opposite, really just kind of surrender control and get disorganized and kind of fall into a puddle on the floor, right? But a lot of people, probably more than not,
But
of
even
addicts
that can be a form of control, I think, just turning into the puddle. It's control, it's manipulating people when I do that.
That's true.
So sorry, I didn't mean to interrupt, but go ahead.
No, it's true. It's a being passive and being a victim or whatever, all that stuff that goes. But I think if you think about what control is an anxiety disorder, really. It's a way of dealing with anxiety and fear. And if we put order, we get the magical thinking is that if we control everything to such a high degree, then our fears will lessen. The problem is that there's never an end. There's never enough control if we're really an anxious person. So that control really comes right out of anxiety. And I think if we're talking about something to work with in therapy to help, it's the anxiety. It's the managing of feelings that addicts are notoriously bad at managing emotions, and to the point where we don't even feel them. We just kind of disconnect from them. And so recovery is all about baby steps and learning, okay, what am I feeling? As it, and we've kind of half joked about this before. And when I was in recovery, I was like, I felt bad, then I kind of learned good. And it's like these basic, like black and white vocabulary words that a 2-year-old would learn. But I was just learning those and really how it felt. And I think that kind of work as a way of allaying anxiety, but also more productive ways of then control in terms of finding out what we need, finding out how to ask for it, finding out what we're feeling, and these are all almost basic life skills that a lot of addicts somehow don't get or lose. And these are things like in daily in our groups and Seek Integrity, we do just those kind of things with group check-ins. So it's a matter of learning kind of new ways of framing it. But I think control itself as a strategy to make my world safer or more predictable or whatever is kind of a losing one. We pay a price for it that's much greater than other ways to handle anxiety.
Yeah. And addicts new to recovery, without the coping mechanism of the addiction, we suddenly feel all of the world around us. I remember thinking in early recovery, God, if people would just behave the way I want them to behave, it would be much easier to stay sober. And, the world doesn't work that way. I mean, that's what the serenity prayer is about. God's grant me the serenity to accept the things I cannot change, which is everything that everyone else on this planet thinks and does. I have no control. The courage to change the things I can, which are what I think it do, and the wisdom to know the difference. It's a very simple prayer, but it's very powerful. And it's just basically saying, I'm not in control of you, and you're going to do what you do. And if it makes me anxious or angry, I'm going to have to learn to deal with that, because you are not going to change so that I can stay sober. Not your job. And it's one thing that almost every addict has to learn fairly early in recovery is I'm in charge of me, and that's it.
Right.
And we don't like that. We want everyone else to behave the way we want them to behave, and it just it doesn't happen. So yeah. Any suggestions on how to stop quickly with my negative self-talk? Great question. When it's happening, I try to distract my mind by listening to meditation or reading, but it almost always happens in the middle of the night. Yes, it does. I am doing my FTD, that's a full therapeutic disclosure for those who don't know, next Friday. So the pressure is mounting and I feel I am in a pressure cooker. So yeah, negative self-talk in the middle of the night. Thoughts, advice?
Yeah, wow. I think probably all of us, including me, have that. First of all, the situation, right? A full disclosure, formal disclosure is a big deal, and it's a lot of pressure. And so it makes sense to me that you would be a little dysregulated right now. But I think also, we're talking about anxiety earlier. When we think about negative self-talk, that's often kind of a voice that's our anxiety with a voice. It's all those, it's all our worst fears, all the worst beliefs about ourselves, all the sort of stuff that's, 99.9% false and unreal and never going to happen. But I think that's when those old voices, and these are self-talk, negative self-talk is really a habit. And it's something that is deeply ingrained. We can use it sometimes as a, not consciously, but as a payoff to almost to punish ourselves. And it can keep us locked in. So I would say I would name it. I would say that this is a voice of my irrational beliefs. These are, it's really important, I think, to separate yourself or disconnect yourself from that voice, that negative self-talk. That's not you, that's your worst fear. I've had clients who are able to say, that's my father's voice, that's my mother's voice. They actually could picture the words and hear their voice from their past of whoever kind of planted that in there. But I think the one way to do it is to look at the serenity prayer, to release. And I think under a stressful situation like this, you're under a real fixed, real world event that's happening soon. So you're going to be under a lot of stress. And I think it's going to just be some tough sleep over the next couple of nights. But I would really use the serenity prayer and any other tool you have, just let it go and let it go again. I use breathing when that happens, and that happens to me not infrequently. I will say, just from experience, things look far worse in the middle of the night than they do at the crack of dawn, when solutions and other kinds of things seem to fall into first place and I get perspective. But in the middle of the night, there's tragedies afoot. And I just really try to tell myself, first of all, losing sleep is not helping, but also just to kind of use my serenity prayer, use positive affirmations, which you have, and other things. And the other thing I did, worst comes to worst, I had a call list of people that I could call 24/7. So, because most of my troubled moments were in the middle of the night, and I would say, I can't possibly call somebody, I would wake them up. So I didn't think of this, my sponsor, suggested it, get some names of people that you can call anytime. And I was really glad I had those. And so that's another resource you might look at.
Yeah. What you're asking about, I always call it living in the wreckage of the future. It's, some people live in the wreckage of the past. As addicts, particularly in recovery, we love to live in the wreckage of the future. And we always come up with the worst case scenario times 10. I've got my full therapeutic disclosure, and I'm going to read it, and then somebody's going to drop a nuclear bomb. This is where we go. It's not just my wife is going to be so angry that she leaves me. It's like the world will catch fire and blow up. We jump into the wreckage of the future, and in the middle of the night, I do a gratitude list, and I will reframe. I will do a reality check. I'll reframe. You know what? We're doing a full therapeutic disclosure so that we can really, truly begin the process of healing our relationship. She needs to get the full truth so she knows she's at ground zero. And now we can work to rebuild relationship trust. That's what a full therapeutic disclosure is about. Getting her all the information so that your relationship, it's all out there. Now you can just focus on healing. So I always try to reframe it, and then I do a gratitude list. Like, she is sticking with me long enough to do this therapeutic disclosure. I know that I've written all of this stuff. There are no lies. There will be no more secrets. Won't that be great? Just do a gratitude list. And I find it that a gratitude list and a reframing exercise like that will really change my state of mind, at least temporarily. I may wake up 20 minutes later and do it again. But
yeah, no, absolutely. Yeah.
So.
And I have the pleasure of knowing this person. You have a lot of tools, and I would use some of your art and look at some of the different castles you've been in and see what the lessons were. I'll just use that from an assignment. Yeah. So, yeah. Thanks.
Yeah. You talked about addiction to intensity being the result of trauma. I am addicted to intensity, but didn't suffer trauma. Possible, right? I'm going to let you roll with that one.
Yeah, I have two thoughts on this. Yeah, of course it's possible. Not everybody who's addicted to intensity has trauma, although I think if we start digging, quite a few of them do. But you look at some of the extreme sports, people that I've had clients that ski down the XX black slopes or whatever in the back high. It's just to put an extra life-threatening edge on it, on the ordeal. Saying they didn't have trauma either, just addicted to the intensity. The intensity is about something. At some point, their system got dysregulated, and this became sort of a new normal. So I'd want to look and see where that happened or why. And then also, when somebody said I had no trauma, and I'm not trying to find trauma everywhere. There are people that don't have it, of course, but
there are 3 people on
there are 3
the
people
plane
exactly
that don't have trauma.
Right. But one thing I always ask when I hear that is I talk about neglect, and we know now that neglect is defined not as not having, food or material goods, but it's what people don't have in cases of this kind of neglect is parental interest, parental involvement, what we call parental attunement. Parents who give hugs, who say, I love you, who come to your recital, who come to your game, show an interest in your life. A lot of people who have, that kind of neglect can result in trauma. And a lot of people don't recognize it as such because they look back and they, weren't sexually assaulted or physically abused or any of that, but they were emotionally abused of sorts because they just didn't get the attention. So that may be there. You take a look at that, but there are people out there that are drawn towards sensation seeking just by. Sometimes I've had ADHD clients with no trauma history who were also drawn towards sensation seeking because of their ADHD. So there are other ways to get there, but I always am interested to make sure we rule out any possibility.
Yeah, and a lot of addicts new to recovery come in, including myself, come in to therapy or treatment, and they get asked about childhood or their childhood, and they're like, oh, my childhood was great, my parents were really nice, and and then when we dig a little bit, as happened with me, it's like, oh, that's trauma, really? Oh yeah, I guess it is. So yeah, anyway, I look for trauma. David is professionally trained and doesn't look for things that aren't there, but sometimes I do. I admit it. This is a follow-up to the Covenant Eyes accountability report question. The reason I'm getting the accountability report is my husband agreed to download an accountability app, but still doesn't want to talk to anyone. So there's no one else who knows about his porn problem other than me, his wife. I agree that it's a terrible position to be in as a spouse. I don't really know what to do about that since he doesn't want to go to meetings or tell anyone or even speak to a therapist. Let's address that part of this. This was kind of the first question, but we didn't really address, as a betrayed partner, what can you do when the addict doesn't want to get treatment? You're muted, David. Sorry.
This is a really difficult position, obviously. And so thank you for that clarification. It makes more sense now,
Yes.
What happens. But I think what you can do is, I would guess, put your effort into boundaries. And by boundaries, I mean, what actions might he have to do to protect you and keep you safer? And part of that may be that you have a boundary that you're not going to be his accountability partner, that you're not going to be the one that is responsible and being thrust into this role of policeman or gatekeeper or guardian, but that one of your boundaries that he needs to get a sponsor, or needs to get a therapist, or needs to take some kind of forward moving step. Now, the thing about boundaries is that you have to be willing to follow through. But I think somehow shifting the dance. So you're not doing just the same thing and going along with it, but shifting the dance a little bit so that he's put in a position of maybe a little more pressure to take some action. And then we have other things to offer. There's interventions per se, but we at Seeking Integrity, we offer consultations and other kinds of things, smaller little 90-minute sessions where the two of you can come together and meet with Dr. Rob or with me and maybe talk about some ideas, and maybe that can kind of shake up the system a little bit as well. You may need an outside person like that, or a therapist, or somebody else could do it also. But just, I think right now you're in the status quo, And I think your addict is not going to make many changes unless something else changes, and that's probably going to have to come from you, honestly, in terms of a boundary, saying this is not okay anymore, or you need to do this or that. But the addict, just because of that inertia and the not wanting to make many changes, will stay in this a pattern that's not a very good place to be indefinitely. So I think you're going to have to be the one to give a little shove to put it off center somehow.
Yeah, I'm glad you're here getting support for yourself, because you absolutely deserve to be supported as you go through this. Sometimes betrayed partners thinks, why am I the one going to the webinar? It's like, you don't have to come to the webinar. You deserve to, because you deserve some support. It'd be nice if he'd get some too. So I kind of feel the pain of being stuck in that situation. What else
I might, sorry, Scott, we have a lot of webinars on sexual relationship healing for betrayed partners specifically. And you might, if you haven't, try one of those and put this question to some of those people and see what kind of feedback you get. They're also having that lived experience.
Yeah, and there's drop-in groups for betrayed partners too, where you can discuss with other betrayed partners, because I know you're not alone, and maybe somebody found a way to get through to their husband or their partner.
Right. No, exactly.
Yeah, for sure. What is the bare minimum behavior change we should see before the addict is ready for a full therapeutic disclosure? My husband has been abstinent, I assume abstinent from addiction, for 16 months and is seeing a qualified therapist for 5 months. He attends a couple of men's group weekly daily S calls, which is sex addiction recovery calls, but he's still defensive, angry, resentful. Recently broke multiple boundaries, not the non-negotiable ones, but still broke some boundaries. And I've caught him not being fully transparent and lying even over small things. Full therapeutic disclosure is scheduled in 1 week. Is it too soon?
Boy, those are the first half of that. I was thinking, okay, this is coming along well, right, with the timing and stuff. But yeah, then there were some red flags that flew up there with the dry, drunk, defensive, angry, resentful, and multiple boundary violations. So yeah, there's some problems here. And I think, I don't know who you are, I don't know your husband, but when I see these kind of symptoms, I worry about somebody not digging deep enough in their program of recovery and kind of skating through a little bit without doing some of the hard necessary work. Those are really warning signs to me when I see people getting defensive and angry and blaming and violating. It's a real danger sign. So if I were his therapist, I might want to put a hold on the disclosure. Although from a time point of view and that's all good. But I worry because the disclosure is something that really has to occur in the context of trust and safety and a willingness to work on this relationship. And, it's a big formal deal with 2 therapists and both parties and back and forth, and it's a long process. And I think if it's done with this kind of noise around the edges, it kind of implies to me that the whole disclosure could not be as productive as it could be otherwise. So I don't know. I think this might be something to take to his therapist and your therapist. I assume you have one too if you're moving toward disclosure. And maybe the 4 of you can talk about this as a decision, because it might not be the right time if he's kind of doing these testing behaviors or pushing boundaries or doing all the stuff he's doing. I just have a little bit of concern about doing it right now. But I think obviously there's a lot of factors that I'm not aware of, but I think it might be something to bring to seriously all 4 of you to see if this is really the right time. And maybe if you decide it's not the right time for you, that might be impetus enough to push your husband toward getting a little more engaged in his own recovery.
And, I'll just add to that. I mean, really, he's been in recovery for 5 months. He's been seeing a therapist for 5 months. So, that's kind of when I consider it the start of recovery, even though he's been abstinent for 16. So actually at the 5-month mark, defensiveness and anger and resentment and still, trampling some boundaries here and there is kind of normal. And also 5 months is kind of the normal time frame for a full therapeutic disclosure. But I agree with David, it's worth a conversation. If you are not comfortable receiving disclosure right now, then you are not comfortable receiving disclosure right now, and it probably shouldn't happen. So I agree, it's worth a conversation with the therapist, because David and I are sort of, playing guesswork here from what you give us. I mean, it's a limited amount of information. So yeah. Let me see. What else could you recommend for calming and or meditation for someone who gets triggered by breathing and counting? So this is someone who gets triggered by breath work and counting. All the relaxation techniques are very similar to him. This is a follow-up to the hypnosis question, are very similar to hypnotic induction techniques. So what other tools do we have that aren't so close to hypnosis that this individual might use?
Right. Okay, interesting point. So there's other ways to do this. One that comes to mind is called tapping. It's emotional freedom techniques. It uses the same meridians that use acupuncture, and just by alternately tapping on different points in your bodies. And there's certain books that have different protocols for different symptoms that are going on, but that can be something that really is very helpful for regulating. Just tapping your one left, right on your thigh, or even on your arms. You can do it. So that also is a way of kind of engaging your body's own ability to self-regulate, but the tapping kind of spurs it on. I like mindfulness and visualization. If you just kind of get quiet and do there's wonderful guided visualizations that are recorded, a ton of them on YouTube, which are also quite good and very calming and relaxing. Breathing is always good, although I see what you say about the induction techniques. What we're trying to do is just really recognize the whole mind-body connection. And so one other one that might be useful, there's progressive relaxation techniques where you basically kind of tense or firm up different muscle groups and then relax them from the head down to your feet. So you kind of scrunch up your face and relax it, and scrunch up your shoulders and relax them. That can also help. So I would go for different physical techniques. There's a ton of this stuff on the internet, and I would just look through and see what appeals that you don't find triggering. But there should be a lot of different resources for you out there.
Yeah, and if you have somebody in your support network who is a calming personality and a calming person, a quick phone call with them, or going to a 12-step meeting, or there's an online support group that I go to, and it's in the middle of my day, and sometimes I'm kind of wound up, and all I want to do is open up the Zoom room and just be there, and I don't even really listen. I just let the voices kind of soothe me, because I know that these are safe people who care about me, and I don't need to know what they're saying right now, and they don't need to, I just need to be soothed. And it's a different way for me to get that than grounding techniques and breath work, which I use and use often. But yeah, talking to other people, I think, can be very calming. And
I would just suggest also animals. I mean, cats or dogs, or if you have a pet, or bird. I mean, the way we relate to our animals is very calming as well. And animals, I think, have more body sense than we do about how to regulate and how to stay regulated. And there's really interesting studies about what's called co-regulation, where we can co-regulate. And when this happens with people who are married, after a while they can co-regulate, meaning their bodies, their heartbeats start being in sync. And there's studies that women that live together start having menstrual periods at the same time, and our bodies kind of feel what's going on around us and co-regulate. And so our pets can help us do that as well. So yeah.
Okay, I'm going to ask the question that I've been sitting on. The question about me. So we talked about intensity and intensity addictions and trauma. So I'm like one of these weird people. I'm an, I'm an alcoholic and a drug addict in addition to being a sex and porn addict. For me, sex and porn addiction are very much intensity addictions, and I'm chasing the adrenaline along with the dopamine. When I do alcohol and drugs, I mean, those are downers. This is not meth. This is not cocaine. I mean, marijuana, a depressive, alcohol, a depressive. Is that a normal pairing? Why would I have one intensity, side and the other a downer side? And I'm not a co-occurring. I'm not doing them at the same time. I'm a cross addicted, so I switch from one to the other. Is that a normal pattern? How does that develop, and et cetera?
It's actually a really good question. When we look at patterns of behaviors, there's even back to Patrick Carnes did some really interesting work on intensity and sex addiction, where the sex addict has this upside, right? Getting built up with the intensity and the build up, the preoccupation, the fantasy, all that leads up and culminates in the acting out. And then the addict has the coming downside. And oftentimes there's the remorse, there's shame, there's feeling like crap and guilty and all that after you act out. And so people treat the downside sometimes as well. So sometimes they are connected, and sometimes not, as kind of what you just implied about yourself. I think, and I'm much more of the numbing, freeze kind of alcoholic person. That's my drug of choice. And so I think it just depends on what part of our cells, our psyche, our trauma that we're treating at that given moment. I think certain kinds of traumas do lead toward the sensation seeking, and in other aspects, we just want to kind of numb out. And sometimes they're paired, like that up and down, and sometimes they're separate. So I would just, it'd be interesting just to observe and see when you have an urge toward one or the other. If there's any differences there, but I would suspect there are, that they're just not random, but they're related. But oftentimes they're joined. They're one is the upside, one's the downside. But also sometimes we see them separate, where you can just have that urge to numb out without in any way corresponding to some counteracting up intensity force to I don't know much research on that, actually.
Yeah, I'm thinking about like the cycle of addiction, where we get triggered and then we slide into fantasy and then ritualization, then we act out. And then the next stage is numbing, and then there's kind of despair. And I kind of, with my sex addiction, I'll spin through the fantasy and the acting out of them. And then I usually kind of spin off into a different cycle with alcohol and drugs. I mean, I haven't done this in a long time. This is not present tense, and maybe the trigger there is different, where I want to numb out, whereas the trigger up here at the beginning of the sex addiction cycle is, I'm bored and I want some intensity. And then I spin up. So my cycle was almost like a figure eight. It was like two attached cycles.
Right.
Whereas,
and I think normally they do, the literature kind of describes that as them being connected, right? That the remorse and shame and stuff after you act out, that's the other side of the figure eight. So most people assume they're connected and kind of reciprocal, but I think they also could be separate, frankly.
Yeah. But then the follow-up question then is, with co-occurring addiction, we do tend to see uppers with sex. I mean, we do tend to see meth or cocaine linking to sex and porn rather than alcohol. I mean, people who get really drunk don't always act out sexually because they can't, unless they're using it to disinhibit to a certain point. But then you get drunk enough and you can't. So with co-occurring, is it all intensity?
For the most part, if we think about that intensity side, it's a chemical profile we're looking to put our bodies through, right? With adrenaline and dopamine. And we can do that in different ways. We can do it with amphetamines. We can do it with different behaviors like gambling or porn or sexual acting out, but it all gets our brains to the same place. And so when the co-occurring piece can be all of those things or mix and matching of those things. Oftentimes in recovery, we see people getting out of gambling, or rather out of sex and porn, getting into gambling or work or something, or exercise, something else. But usually when we have co-occurring, there is alcohol, there's food, there's that downside, right? That more numbing stuff that kind of counteracts the intensity side. And that's where we can see not only alcohol and benzodiazepines and opioids, but food and binge shopping, TV watching, all those are kind of that numbing effect. And so that can totally be co-occurring, where they're all kind of happening as part of the same addiction cycle, not necessarily at the same time. But I have a lot of clients who use a lot of meth and porn and sex, and then used alcohol or over-the-counter meds or benzos or something else to kind of calm down and be able to sleep after 5 days.
Yeah, particularly binge chemsex users. You got to get some sleep at some point.
At some point, right?
Yeah. So we've got a great question left, but we're out of time. It's a big question, so I'm going to save this one until next week. And it looks like another one just came in, so I'm going to save both of these, and we will begin the Q&A next week with this. Thank you all for being here. Thank you for great questions. David, thank you. Anything you want to say to take us out?
Just be aware of that sensation seeking, because it can get us back into trouble if we're not careful. Try to get out at what's underneath it. That's what we need to work on.
Yeah. Okay. Thank you, everybody, for being here. I copied that question out, and I will save it for next week. And we'll see you then. Good night, everybody.
All right. Thanks, everybody. Good night.